Hello, I'm Simone Keizer-Beache, Chief Medical Officer at St. Vincent and the Grenadines. Cervical cancer is the second leading cause of death of Vincentian women, and it accounted for 45 cases, deaths between 2009 and 2015. Imagine, we have a population of 110,000 and 45 women, 45 mothers, 45 sisters, aunts, friends died from cervical cancer. These deaths occurred when these women were between the ages of 35 to 65, in the prime of their lives. How do we prevent this? How could we prevent another mother losing her daughter, another daughter losing her mother, another person losing their friend? There are different ways of preventing cervical cancer. There's screening, which is your pap smear, where you can look at the cells. A test is done, we look at the cells and we see if they're precancerous changes or they're cancerous changes. So basically any abnormality of the cells. And if we find those things, we can do surgery or different procedures where we can remove those cells. Sometimes we're successful, and sometimes, depending on how far along the changes are, we can't do much. And that person must have chemotherapy or radiotherapy, surgery, and hopefully recover or extend their lives. Unfortunately, sometimes it doesn't work. How can we prevent that suffering? How can we prevent the emotional cost, the financial cost of having cervical cancer? We can give our young girls the HPV vaccine. Why the HPV vaccine? It's been proven that HPV is responsible for most cases of cervical cancer. And just as we use vaccines to prevent measles, mumps, rubella, diphtheria, pertussis, tetanus, tuberculosis, polio, we can use this vaccine, HPV, to prevent HPV infections and hence cervical cancer. We can also at the same time prevent genital warts. Because of this clear opportunity to prevent suffering, to prolong life, to ensure a better quality of life, to save our Vinci girls, the Ministry of Health took the decision to introduce the HPV vaccine. And we are asking you to consider giving your young girls. We want to give them before they become sexually active because that's how HPV is transmitted. So we need to get them before they start any sort of sexual activity so that the vaccine can prevent the infection with the HPV virus and hence decrease the likelihood of developing cervical cancer. That's why we want to give the grade 6 students. There's a lot of anxiety about this vaccine because of a lot of the stories you're hearing. However, I want you to know that this vaccine has been found to have less side effects than some of the other vaccines we are given. All vaccines can cause a slight fever, maybe a little pain at the site of injection. Some people even faint before they get the vaccine because they're so afraid of the needle. But the fainting is not caused by the vaccine. So we want to encourage parents, guardians, friends, young girls. You're so savvy on the computer. Look it up. Look at good sites. Sites like the World Health Organization, WHO, PAHO, CDC. Look for studies that are not just one story, one person's impression, but look for sites, look for evidence based on the numerous persons who have received the vaccine. Over the last 10 years, thousands and thousands of persons have received the vaccines, and there are good studies out there which would give you the proper evidence of what the side effects are and the possible complications. The Ministry of Health is very aware of the concerns, and we do not want our family, our friends to be harmed in any way. And therefore, we would not give you something that we know will do you harm. Rather, we want to do good, we want to protect you. We see the end results of persons who do not have, who have cervical cancer. We see the pain and the suffering. I am going to give my daughter the HPV vaccine when she is in grade 6, because I do not want my child to suffer or have any chance of having cervical cancer. Whatever I can do as a mother to reduce any potential suffering of my child, I will do. I will not knowingly expose my child to anything that I know is going to cause her harm. But she will receive the vaccine when she is in grade 6. So, as I said before, your health, our health, is a shared responsibility. The ministry's part will provide the vaccine free of cost. It's there if you want to take it. So I hope that you will come to the conclusion that it is to your daughter's benefit, your friend's benefit, to the nation's benefit, protect our nation's future, prevent cervical cancer, and save BC girls.